Welcome, and thank you for joining this presentation on delivering high-quality post-diagnostic support during the COVID-19 pandemic. My name is Julia McKenzie, and I'm one of the four post-diagnostic support leads with Alzheimer Scotland. Since 2013, the Scottish Government has had a national commitment that everyone newly diagnosed with dementia will receive a minimum of 12 months post-diagnostic support delivered by a trained link worker. In many areas across Scotland, Alzheimer Scotland link workers are funded to deliver this post-diagnostic support using the 5-pillar model as a framework. This model was developed through an evidence-based research project involving people living with dementia, their families and carers. Prior to COVID, link workers mostly visited people in their own homes, providing a personalised service tailored to their needs over the course of the 12 months. Then COVID happened. We wanted to continue to provide this much needed service. The challenge was how we were going to do this when we could no longer visit people in their own homes. Alzheimer Scotland also wanted to ensure that nobody faced dementia alone during this period, and so our digital training team began an extensive programme to train all staff in using online secure digital platforms. The next challenge was introducing this new way of working to the people being supported by the link workers. This involved the link workers involving the people living with dementia and their families in supporting them to use these new platforms. Where people didn't have access to devices but wanted to try online work, then the link workers were able to secure new laptops and tablets through the Scottish Government funded initiative Connecting Scotland. Once these devices were obtained, we were also able to access additional support to help people learn how to use these devices. In cases where this was successful, the person with dementia was able to engage in their support with their link worker, and family members were also able to be involved in this support. It also meant that those people were then able to engage with other online support groups, various groups and activities that were being organised by Alzheimer Scotland and others. However, online wasn't suitable for everyone, and in these situations, the link workers continued to provide support via the telephone if this was appropriate. And often this would involve asking for the telephone to be put on loudspeaker so that everybody who was there would be able to be involved in the conversation, and everybody would get an opportunity to speak. If telephone was difficult for people, then the link workers adapted their services and were able to provide written support through emails and through sending out written materials. The link workers were also able to send out activity packs to help keep people engaged during the period of lockdown. So what have been our key findings during this period? Working online has allowed people to get together that may never have had contact with each other previously. We have had people living with dementia join activities that are taking place hundreds of miles away from their home across the other end of the country. It also meant that the link workers have been able to engage to arrange informal peer support that would have been very difficult to organise previously. People who live in remote areas across Scotland have been able to access support that would not previously have been available to them. And the types of support and activities that people have accessed have been things like virtual tours of the V&A in Dundee, virtual tours of other museums and art galleries, online art classes, online ceilidhs, dementia doggy bingo sessions, peer support groups, dementia cafes, other education and information sessions, and carers support. Link workers have been able to engage online with the person being supported and family members who live in different countries. And this has been a new development also. Previously, contact may have been made with family members who did not live close by, but this would not always have been easy. And this new development has meant that family members who live far away in other countries across Europe or much further afield can feel involved in the support that's been offered to their family member. It also means that the person living with dementia can have conversations about their future, about how they're living now and about their future with, and know that family members have been involved in those conversations. So what does the future look like for our link workers? We have once again been able to engage with face-to-face contact with people and been able to go out and visit people in their homes. And this has been hugely appreciated by both the people being supported and by the link workers. However, we're not returning to how things were completely before the pandemic. We will continue to develop the online support, and our link workers will be providing a blended approach moving forward with a mixture of face-to-face and online support and telephone support. The link workers will also be looking for new and creative ways to deliver PDS in the future. Thank you very much for listening to this session. If you have any questions or comments to make, please use the chat function, or if you want to contact me after the conference, please use my email address. Thank you.